see the important and interesting part, how to read an ECG. Now imagine you are being posted in a government hospital and your senior doctor now gives this and asks you to read the ECG. What you have to do first? First, calculate the heart rate. Now take any lead and this is the QRS and this is the R wave. Between the two R wave, you must calculate how many big boxes are there. The formula is 300 divided by number of big boxes between two R waves. If you see, there are almost 4 boxes here. 1, 2, 3 and 4. So 300 by 4, this patient has heartbeat of 75 beats per minute. This is normal, but if there is heartbeat is less than 60, it can be heart block, or if it is more than 100, it can be arrhythmias. So the normal number of boxes to have in between two R waves roughly is 3 to 5 boxes. If less than 3 big boxes, it can be heart block. If more than 5 big boxes, it can be arrhythmias. Here in this patient, we have 4 boxes, which is normal. Now next you have to determine the rhythm. If you see here, between the two R waves, the distance should be equal. If you see here, 1, 2, 3, almost we have 4 big boxes in between these two R waves. Now here also, 1, 2, 3, 4. We have 4 big boxes. We have to check it here all. If everywhere we have equal number of distance in between, then the rhythm is normal. Now, what do you mean by a sinus rhythm? Normal sinus rhythm means the heart rate should be in 60 to 100 and P wave. This P wave is followed by a QRS, and before the QRS there should be a P wave, and the RR intervals should be regular. If you have all these, you will be called as a normal sinus rhythm. Then if there is some pathologies, you can have sinus arrhythmias, junctional rhythms, idioventricular rhythms. These are just rhythms originating from somewhere else, not in the SA node. There can be rhythms starting from AV node and bundle of his. Those are the abnormal waves, abnormal rhythms. This is the criteria for normal sinus rhythm. Then after knowing the rate and rhythm, let's see the intervals. If you see, this is the normal wave of an ECG. In this small box equals to 40 millisecond. I said earlier that as time passes by, these waves will be drawn in the ECG paper by the machine. This one small box equals to 40 millisecond. If you see in a big box, there are 1, 2, 3, 4, 5 small boxes in the x-axis. So 4, 8, 12, 16 and 200 millisecond. This small box is 40 millisecond and one big box which is equal to 5 small boxes. So 200 millisecond. Now this is the P wave, PR interval, QRS and QT. If you see the P wave, it's starting from the P and ending at P. So the number of boxes here is 3 small boxes. So 3 small boxes means less than 120 millisecond. Each box is 40 millisecond. So 3 boxes. Normal P wave should be less than 120 millisecond. Now if you see the PR interval, there are 5 small boxes. 5 small boxes means it should be less than 200 millisecond. Then the QRS has 3 small boxes. So normal QRS duration is less than 120 millisecond. If you see the QT interval, it has almost 10 small boxes. So normal can be less than 400 or less than 440 is also accepted. Now, next we should determine the axis. Now we have the heart rate, the rhythm, and the intervals. Now let's see about the axis. This is the heart, and this is the direction through which the current passes normally. Now let's draw this x-axis and y-axis. If you have 4 quadrants, let's see that this wave is in this quadrant. So this must be normal. Let's mark the angles 0, 180, minus 90 and plus 90. The normal wave accepted is, normal axis accepted is less than in between minus 30 and plus 90. If the vector is in between this minus 30 and plus 90, it is normal axis. But if the vector is between minus 30 and minus 90, this is left axis deviation. This can be caused by many other pathologies. Then if the axis is between plus 90 to plus 180, it is right axis deviation. Now just imagine if the vector is directly opposite in this direction. This is extreme axis deviation, that is in between plus 180 and minus 90. So remember that normal axis is in between minus 30 and plus 90. Now let's see how to determine the axis. Now all you have to do is see these two leads, lead 1 and AVF, the foot lead. Just see here. What you have to do is calculate the amplitude. Amplitude means in this direction, calculate how many boxes are there. If you see in this wave, there are almost 9 small boxes. Now here, there are many small boxes in upward direction, but there are few small boxes in downward direction. In upward, there are 15 small boxes. In low side, there are 4 small boxes. What you have to do is subtract 15 minus 4. So the amplitude of lead AVF is 11 and amplitude of lead 1 is 9. Now just apply this in this formula. This is the formula to determine the axis. 90 times AVF, lead 1 plus AVF. 90 times AVF is 11 and lead 1 is 9 plus AVF is 11. 90 times 11 divided by 9 plus 11. So the axis is 50 degrees. Now if you plot this 50 degree in the diagram before, it falls under the normal axis, minus 30 and plus 90. But if you see, this method is quite taking a long time. You can do this in an emergency situation. So let's see how to easily crack this up. Now, all you have to do is just take lead 1, lead AVF, and let's interpret. If the lead 1 is positive, I mean if it's in the upward direction, and lead AVF is also in upward direction, then it is normal axis. If lead 1 is positive and lead AVF is in negative direction, facing downwards, this is left axis deviation. If lead A1 is negative side and lead AVF is positive, this is right axis deviation. If you see the lead 1 is negative and lead AVF is also negative, if both are negative, this is extreme axis deviation. Know this table well so that you can easily interpret the axis questions. Now the last one, check for ST elevation and ST depression. We all know that whenever a patient is having myocardial infarction, this ST can be elevated or depressed. It depends, non-ST elevated MI or ST elevated MI. So in pericarditis, all the leads will be elevated. That is the difference from MI. In MI, as I said before, only specific leads that are damaged will be elevated. But in pericarditis, all the leads will have this ST elevation. If you see here, this is the ST segment. This one, it should be flat. This is ST elevation. This flat segment is lost and it's elevated. This is ST depression. Again, the flat segment is lost. Now let's interpret this basic ECG. This one has a small problem in it. Try to identify it. If you see here, you can see ST elevations in lead 2 and lead 3 and lead AVF. What I have said before, if lead 2, lead 3 and lead AVF are having ST elevation, it can be a problem in the inferior wall. And the damaged artery or the blocked artery is right coronary artery. So you will have to intervene this right coronary artery. That's how you use a ECG. Now we'll end this discussion by interpreting a small ECG. Now you have been given this ECG by your seniors. Now try to interpret it. You are in the hospital setting. Just as soon as you get the ECG, you just check if this ECG belongs to the appropriate patient and just know about the chief complaint and history. If you see, when you start interpreting, just see, first determine the heart rate. See here, between the two RR interval, this patient has more than three big boxes, almost 3.5 big boxes. So the heart rate should be approximately around 90 beats per minute. Next, the rhythm. If you see here, the heart rate is normal. There is P wave. After that, QRS. And if you see the RR intervals, this is 3.5 big boxes, 3.5 big boxes, 3.5 big boxes. So the RR interval is regular. So this patient has normal sinus rhythm. Now let's see the intervals. If you see the P wave, it's almost within 3 small boxes. So less than 120 milliseconds, normal. And PR interval is within 5 small boxes, that is normal. And this QRS is within 3 small boxes, less than 120 milliseconds, that is normal. And this QT interval in less than 440 milliseconds, that's normal. In this computer, you may try to zoom in and see it. Now for the axis, I told that all you have to do is just check 2 leads, lead 1 and the foot lead AVF. Just remember the table I mentioned earlier. Lead 1 shows upright, lead AVF is upright. So this patient is having normal axis, that is between less than -30 and +90. Now check for ST elevation and depression. Here clearly you can't see any elevation or depression, but be careful that you may think this is ST elevation, but that is not true. If you see the ST segment, it is flat. As I told before, if there is ST elevation, this flat segment would be lost. So this is a patient with normal sinus rhythm. This is a normal ECG. This is how you interpret an ECG. Now let's see some abnormalities. I'll just tell the names here and we'll have a separate discussion on these abnormalities with separate ECG strips. Now mostly you will have arrhythmias showing up in ECGs. What are the types of arrhythmias? It can be SA nodal disorders, AV nodal disorders, SVT, supraventricular tachyarrhythmias, ventricular arrhythmias, and premature beats. These are some important conditions to be noted. And other ECG disorders like bundle branch blocks, pericarditis, Wolff-Parkinson-White syndrome, Brugada syndrome, and MI changes, ARVD, electrolyte changes. All these are also important, and we'll have separate discussion on this. That's all for today, guys. Thank you.